Hello, my name is Dr. Alexander Neubauer, and today I will give you a short information about ceramic implants and about how we use it in our clinic in Midident, Bavaria, in Tittling, Germany. So when here you can see a short glance at our clinic. This is the front office where all our patients arrive. And as I said, today it's the topic about implants out of ceramic at Midident, Bavaria. So if we talk about implants, it's very important to understand that conventional dentists use conventional implants, and these are made of metal. And the metal is called titanium. On this picture on the left side, you see a typical metal titanium implant, which is mostly used in most cases if you have no idea of biological treatment protocols. So the disadvantages and the problems for coming by these metal implants are they work like an antenna. So you can imagine that this is a kind of amplifier for electromagnetic radiation, which is all around in our environment, like, for example, the Wi-Fi, the mobile phones, and all that. Our whole environment is full of high power of electromagnetic radiation, and these conventional implants of metal work like antennas. So what more, if you have metal in your mouth, especially if you have two metals, like for example here the titanium implant and another gold crown on the other side, on another tooth you have the so-called battery effect. So that means that you have electricity in your mouth, and you can imagine that this is not healthy for your mouth, for your health, and also not for your brain, because this can lead to corrosion. Corrosion means that by putting metal into a liquid environment, like for example in the mouth, metal particles can dissolve, and there is a high risk that you swallow them and they go to your intestine and make damages there. Also, a problem of the normal, I call them conventional metal titanium implants, is that they can cause allergies, and many people, it's about 30 to 50%, have intolerances against this metal. So this is why we do not use them for health reasons. And in addition to that, they are often poor in aesthetics. As you can see on the picture, they are black. And if you imagine that you have something black in your mouth and the gum recedes a little bit, it's obvious that this doesn't lead to really good aesthetic results. So that's why we changed many years ago already to ceramic implants. So what is the most important part about ceramic? Ceramics is biocompatible. This means that there is a high tolerability against this, towards this material. So your body does not fight against it, okay? It does not cause any immune reactions or something like that. In addition to that, ceramic is extremely stable and long-lasting. The ceramic implants we use, they are from Swiss Dental Solution. It's a company from Switzerland. They are, in terms of stability, far better than all the regular metal implants. So stability and long-lasting, this is a very important point. Also, you can see they are white, and so you can get highly aesthetic results with it because the teeth are white, and if the new root, like the implant, is also white, you get a very high aesthetic result, and you don't see any black things in your mouth, which you don't want to have. And also, if we use ceramic implants, and this is a big advantage, we can use the immediate implant placement in almost every case. So immediate implant placement, we go to that later point in this presentation. means that if we extract a tooth, normally it's always possible to put in the implant in the same session. So this is what we call an immediate implant, and this is of course a very, very high advantage for our patients. So let's talk about inserting implants. So as I said, we can talk about two different types. One is the late implant placement. This is when a tooth has been missing for a long time, for example, 1 year or 2 years or 6 months. So when you place an implant there after several months or years, we call it the late implant placement. But as I told you before, we can also use the immediate implant placement, what means that we immediately after tooth extraction, we put in the implant in the same session. So let's go into detail. So how does it work? The procedure for a late implantation. So on the left side, you can see this is the jawbone, and the red thing here is the gum. Okay, so how does it work? So under local anesthesia, we make a little cut on the gum, and we drill a little bit in the jawbone, about 8 to 11 millimeters. And after we have been drilling, we have a small hole. And in this hole, we put in the screw, the implant out of ceramic. So and you can see the implant fits perfectly to the hole we've been drilling before. Okay, so we put in the implant and it's already a high stability. And then we close here the gum again. We make a suture and close the gum so that there is a perfect healing chamber for this implant. And the healing time is approximately about 3 months. So in the area of the posterior molars, we do not put any temporary crowns or temporary prosthesis or anything. Why? Because we want to avoid that pressure or loading is coming to the implants in the posterior area of the jaw, because here are high forces and we don't want to make you bite with high forces on a freshly inserted implant, because we should take care that the healing time of the approximately 3 months is really the right time we have to achieve, so that the implants are really well healed in your jawbone. So, but in the area of the anterior teeth, there it is possible to put a temporary prosthesis, a temporary crown, immediately after putting the implant, because here in the front area, we do not have these high powers, these high pressures like we have in the back. Okay, so we can put in a temporary crown, for example, so you don't leave the clinic, the practice with a missing tooth, which is not so nice looking. So we can put in the front teeth temporary crown, but what is important, the implant must not be loading during the healing phase, for example, by chewing. Okay, so don't chew hard, it's just a aesthetic provisional crown, not a functional one. Yeah, here you can see a picture of an immediate implantation. And you can see here we have been, there were 2 front teeth, and this patient had a lot of problems with these teeth because they have been root canal treated. And we decided to remove the teeth, and in the same session, we put in the immediate implant out of ceramic. So how does it work? First of all, we put in some anesthesia, remove the tooth, clean the wound, and here we use a highly specific biological treatment protocol with ozone and neural therapy and many more things, so that everything is perfectly cleaned. And after having the perfect cleaning, we put in the implant in the same session, in the same surgery. So the healing time here is again about 3 months in the case of anterior teeth. And we can put in immediate temporary prosthesis, immediate temporary crowns, like you see here on the right picture. So here we put in some crowns so that the patient does not leave the office, the practice, without teeth, and looks very, very nice here. And of course, you can see the advantages by putting the implant in the same session like the extraction. So first advantage is it's only one procedure. It's a one-step procedure. And this leads to the whole tissue, like the gum, the bone, and everything is stabilized immediately by putting an implant inside. So what we do avoid is the bone loss or tissue loss or soft tissue loss, because putting in an implant and replacing the tooth in one session preserves the bone against bone loss and tissue loss and losses we do not want to have. So, and also it's a very gentle and minimal invasive and of course aesthetically pleasing procedure. So you can imagine after the healing time of 3 months in this case, we remove the temporary crowns, and then we can put in full ceramic crowns which have the same color and the same aesthetic like the natural teeth, and you won't see any difference afterwards. No black things, no black titanium, no metal. So these two black things you see here is from the sutures which we used 10 years ago. Since 10 years we use different sutures, and the actual sutures we use now, you don't see them anymore. So what you always use in implant surgery is PRF. It's you can imagine it's autologous blood and stem cells. So how does it work? Directly before the procedure, we draw the blood and we put it into and we make centrifugation. And here you can see the glass, and here is the blood inside. And the only thing that happened is the blood was centrifugated, and by the centrifugation we get the autologous blood and stem cells, so from your own body. So these are the best cells you have in your body. And the advantage, of course, if we use these cells around the implant or around the surgery area, we use only 100% of the body's own material. So it's the best material we can use in the surgeries. Why? Because there are many healing promoting cells in this, and this leads, of course, to accelerated wound healing and has no disadvantages. It's full of advantages, and it's a very high biological treatment. And we use it always when it goes to surgery. We always use the PRF and the stem cells. And here you can have an idea on the lower right picture how these worthwhile cells look like. So now I can show you a short video about how implant placement works. So you can see the placing of an implant is really a very, very safe procedure. And it's really like extracting a bad tooth, mostly with a lot of bacteria and toxins. And it's really a good, healthy thing to replace infected teeth with ceramic implants, because they are the best, in my opinion, the best biological option for replacing missing teeth. So, but what is important, we should talk about the preparation and biological surgical procedure. So one thing that is really important is the vitamin D3 level, because this should be at least at 70 nanogram per milliliter at the time of surgery. Why? Because this enables perfect healing. So how can we do it? The vitamin D level should be adjusted, as I said, before surgery. So you can do it with your physician or alternative practitioner, or you can order from us the bone healing protocol. And so this is a combination of supplements, vitamins, etc. And you can raise your vitamin D level up to the 70 nanogram per milliliter in about 4 to 6 weeks normally. So it's also advisable to check and report the blood value for vitamin D3 14 days before the surgery to the practice. And after that, you are prepared, and then the rest is our job. And we follow biological surgical concept of Medident Bavaria. And there is another video where I explain exactly what is part of this surgical concept. And I advise you that you also check out this video so that you can see what the perfect biological treatment protocol at Medident Bavaria is like. Well, we have to, more or less for legal reasons, we have to talk about also the risks of implantation. I give you here a short overview, the detailed description on the surgical, you find the detailed description on the surgical consent form, which we send, of course, to you before the surgery. So let's begin with this sentence. The insertion of implants is routinely performed in our practice. So this is really routine procedure. So my team and me and my staff is perfectly prepared for this. But as I said, the law says we have to talk about risks. And so we start with the general complications. So this might be bruising, inflammation, and wound healing disorders. So all of this can be treated really very well. In the worst case, another procedure must be carried out and the implant can be removed easily. So this is no problem. This does not happen really very often, but an implant can also be removed in this phase. So it might come to hypersensitivity reactions like allergies, for example, on narcotics or disinfectant. Also, thrombosis and embolism and bleedings might happen. So let's talk about the procedure-related complications. So during implantation, and especially when it's about drilling the hole for the implant, it might be possible to damage the roots of the neighboring teeth, maybe, of opening the sinus. You can see here the sinus in the upper jaw, one on the right side, on the left side. It might lead to sinus infections, nerve damages, damage to the mandibular nerve. You can see it here. This is the mandibular nerve. And damage to the tongue nerve, fracture of the jaw, and implant loosening. So what we do is we always perform a 3D scan like a CBCT before the surgery. So we have perfect overview about the surgical region we work on. So all these complications will not happen, but I just have to tell you about that. So after the healing time of the implants, as I said, approximately 3 to 6 months, it looks like this. You can see here 1, 2, 3 implants. We removed already here the provisional crowns, and you see the soft tissue is perfectly adapted. We have no resorption of the bone, no resorption of the soft tissue. It's wonderful and stable. And then we can start making new teeth. Of course, here you see the new teeth. They are also made out of ceramics. So We have in the mouth, it's ceramic, and in the bone, it's ceramic. So we have all over the mouth and the bone, the same biological material, it's ceramic. So this is the best thing to do. So you see here the crowns, and we make a cementation of the new crowns on the implant. We use a very, very healthy cement to put on the crowns on the implants. And yeah, as I said, you have now then ceramics in the mouth and in the jaw, and this the best biocompatibility and of course the best aesthetic result. So summary from my side is implants are a safe and long-term stable solution to replace teeth. We use ceramic implants for reasons of high compatibility, stability, and excellent aesthetics. A special feature is we can perform immediate implants, which are possible only with ceramic, okay? So a biological optimal surgical treatment protocol is crucial. As I said, there is another video. Please watch this video about this biological treatment protocol. I promise you it's worth it, so you can get an idea what's the difference between holistic biological dentistry surgery and convenient or regular dentist. So, and building a good vitamin and nutrient balance contributes to perfect healing. And so this is all I wanted to tell you today about the ceramic implants. And if you look at the lower right picture, I think you would not recognize where the implant has been inserted. And I give you a little idea. So this tooth here, this one has been replaced by a ceramic implant, and you can see perfect gum, perfect smile, perfect bone. We did not lose anything. We did not lose any bone. We didn't lose any soft tissue. And it's simply a long-term stable and high aesthetic and especially healthy result. So for more information and contact, you can visit our website here, or I also wrote a book. It's called The Secret Power of the Teeth. It's right now it's just in Germany available. You can look at YouTube, of course. We have also some English videos on there for more information. I've got a German podcast. You can follow us on Instagram and Facebook, and I offer also a free expert webinar, but this is also in German. And so to close for today, I gave you a short view about why ceramic implants are the best solution to replace missing teeth, and what are the advantages and how the surgical procedure is working. And I hope you enjoyed it and wish you all the best, and hope to see you soon here in Germany at Medident Bavaria. Yours, Dr. Alexander Neubauer.